Dear friends, I am Dr. Navdeep, MBBS DNB from Navdeep Hair Clinic in Panipat, Haryana, India. Today we'll be discussing all the instructions, all the care after hair transplant, what medicines are to be taken, for how long are to be taken and how they are to be taken, what care has to be taken after transplant, everything after the transplant. Today we have a patient with us. His name is Siris Ram Basnet.
Yes, right.
What's your name?
Yeah, Cyrus from Busnet.
Cyrus Ram Basnet. He's from Thimpu in Bhutan. From Thimpu in
Yeah,
Bhutan.
that's right.
Yes. So how was your experience?
Like, let me explain about how I got to know about this clinic. So it was an year ago. I was looking for a clinic where I can transplant my hair. So while browsing through lots of clinics, I found, Navdeep, Dr. Navdeep Goyal's, hair transplant clinic was really good by looking at the all the reviews done by the people, like there are 1.1k people saying good things about this clinics, and I thought this must be the right clinic for me. So that's how I got to know about this. So I came here today, and you know I'm really glad to meet with you, because you're very approachable, very friendly, you talk very well, and the nurses who helped during the transplant are really good. So initially my experience, let me share my experience. So initially, it was painful, because I did not get the anesthesia before that, but afterwards the pain was gone. So for the last, it was 3 hours, 4 hours,
3 4 hours.
yeah, 3 4 hours, I had a very good experience with doctor and the nurses who helped me with this transplant.
Yeah. Thank you. So today we did this frontal area transplant for him. All this hairline was made for him. He had lost his temples. All those temples were made. His hairline designing was done properly. Angulation was done properly. Slitting was done properly. And this is him after transplant. Just done just about 1 hour back. Just finished his transplant. So now we will be telling him how to take his medicines. He has to take up. This is your painkiller medicine. You will be taking it twice a day. Actually, its dosage is 4 times a day. But since your transplant is not a painful thing, it's not very painful, so we give it just twice a day. So you will be taking it morning and evening. Okay? So here you have two types of tablets. One is an antibiotic and one is an antacid. Because both of these things, both this one painkiller and antibiotic, both of them do acidity. So we give antacid along with that. You will be taking all three tablets twice a day, morning and evening. Okay. So this is your tablets for 10 days, morning and evening. Tomorrow morning you will remove your bandage. Okay. Once you remove your bandage, you will be applying this tube only to the donor area. You will not be touching the recipient area. Will not be touching the transplanted or the recipient area. Tube needs to be applied only to the donor area. You are given two tubes. Once one tube finishes, you will start the second one. Okay? You will be applying this tube 3 to 4 times in a day. Okay? This is a shampoo. You will start bathing after 3 days. So on fourth day,
the back donor area or from?
I'm just telling it to you. So from fourth day, you will start the shampoo. You will just take a mug, anything to pour the shampoo in. Okay? A jug, a mug, or anything. You can just pour your shampoo in that, mix it with water, and pour it all over your head. All over your head. You can touch the donor area, but do not touch the front area. Okay? You will clean the donor area on the fourth day, and you will be doing it daily for the next 7-8 days till 10 days. Once your 10 days has been done, then
From 4 to 10.
yes, you will do it, repeating it daily. You will be cleaning the donor area properly with touching, and you will not be touching the frontal transplanted area. Okay? After 10 days, you will be cleaning all the area properly. Video of that is there on my channel, Navdeep Hair Transplant. You will just go through that, and according to that you can wash your frontal area, then send me your photograph on WhatsApp. I will just have a look and reply it back to you,
Yeah.
that whether you have done it properly, needs to be done again, or it's over, like that. Okay?
Okay.
So this is your medicines for 10 days. After that you will starting your growth medicines. We have given you 2 tablets in this one. Both have 18 strips. Okay? You will be taking 1 tablet daily from both of them. And we have given you 6 lotions of this one. You will be applying this lotion twice a day. 1 hour before taking a bath in the morning, and at the time of going to bed in the night.
Okay.
So twice a day. Okay?
Okay.
1 hour before taking a bath in the morning, and then before going to bed in the night. Okay? So this thing. This is your medicines for 6 months, and this is your medicines for the initial 10 days. Once you finish this initial medicine for 10 days, then you will be starting that medicine after a gap of 5 days. You can keep a gap of around 5 days, because you may have some gastric upset or something with these medicines, initial medicines. Those 5 days will cover up your gap and your body acidity and all those things. Once you are well and fine, then you will be starting those growth medicines. Okay?
Yeah.
When you are lying down for the initial 5 days, you will be lying down straight only. You will not take any side. Don't take any side, and don't lie down prone upside down. No, you will be lying down straight only. Okay? The purpose is, if you lie down straight, you will not have any swelling on the face. If you sit up like this, or you watch your mobile like this, or you keep on watching TV like this, the gravity will attract the water down. Whatever water we have put inside your body, inside your scalp here, that will flow down. If that flows down, you will have swelling all over your face. So the way to avoid that swelling is, just keep lying down straight. If you keep lying down straight for 5 days, there will be no swelling, and that will save your face. But suppose somehow you have to travel and all those things, and you get swelling on your face, nothing to worry. All the swelling will go off in 10 days, 10-15 days at a max. So nothing to worry. No special medicine, no other medicine to be taken for that. Okay? But wherever you are at the airport, you are in the train, you are in the bus, you are in the car, you just keep your head position like this. If you keep your head position like this, the flow of water will be down. If the flow of water is down, is backward. If the flow of water is backward, all the water will flow back, and it will not flow down on your face. If this water flows back, you will not have swelling on your face. So you save your 10 days. Okay? Next 10 days you save. So that is a benefit. And this spray, the spray of water, today you will be spraying every 5-10 minutes. Okay? From tomorrow you can spray every half an hour or so for the 5 days, initial 5 days only. No need to spray once you are sleeping. Okay? It's only for the time you are awake. Once you sleep, no need to spray. Okay. And this, at present, it is MS that we have given it to you. Normal saline we have put in this one. But once this finishes, no need to take any medicated water. You can put simple RO water. RO. Okay? RO is a water, purified water. Okay? If you don't have access to RO water, you can put any bottled water, mineral water. Mineral water bottles. In India, we get it by the name of Bisleri, Kinley. Any bottled water you get it, purchase for drinking. That drinking water you can put in this one, and you can spray. Any water. Any water. Okay? Anything else you want to ask?
I'm just curious. So I heard that after hair transplant, so because of the shock, so I lost the hairs as well. So how many days, how many months does it take?
Shock loss. Shock loss does not happen in all the patients. Happens in less than 10% of the patients, even less than that. Happens in very few patients, so you don't need to worry for that. Even if the shock loss happens, all those hairs will come back in 3 to 4 months. Initial 3 months already, anyway there will be no growth. These hairs I have transplanted, initial 3 months they won't grow. You will,
I lost this hair.
yeah, these hairs will be lost. Okay, you will see a good result I will not say a good result, I will say a reasonable result after 6 months. When you will say, okay, now I feel happy, I'm happy with my hair. That stage will come after 6 months only. You will not enjoy your hair before 6 months. 6 months also you get the result with these medicines only. Suppose I don't give the medicines to you, then it takes 1 year to 1.5 years to come. The time increases. These medicines act like fertilizers. We put fertilizer on the plants, the speed increases. Same in the hairs. We put these medicines in the hair, the speed increases. So we get the results little bit early. That way. Anything else?
Okay, that's all. So I don't have any more questions, but I would like to thank doctor and all the nurses for doing my transplant. Yeah, so I trusted this clinic and came here. So I'm really happy with this.
Thank
Yeah,
you.
so-
Welcome.